This is an interesting artificial intelligence. This is more the categorization format, the big data format, where UCSD used a model to screen patients who had chest x-rays for signs of COVID. And apparently, the x-rays, the normal x-rays, were able to distinguish between COVID and not COVID. And there are some things that the computer saw that radiologists can see as well, but they couldn't. This was done almost instantaneously when the film came in, digitally captured. It immediately went to the algorithm, and the algorithm spit out something to say, "Be careful." So it just it shows how when you incorporate this type of information into the workflow, it can give you a quicker answer for something that you might not even thought was possible. Speaking of not possible, this was one I thought was interesting. From a clinical point of view, it may not be that helpful, but it was demonstrating that a simple chest x-ray can predict the race of the patient in a way that radiologists can't see. So it can look at the x-ray image and notice something that's invisible to the eye, and then basically make a prediction based on that. Now, there's some concerns about this, about how when you train using x-ray images, you may be creating a bias because you're actually telling the system information that you may not want it to use. So, but anyway, I'm just giving this example of there are a number of things that it can do. It can just, I read one report where an x-ray predicted cardiac output, or examining the retina determines heart risk, cardiovascular risk, as well as diabetic symptoms. So as we go further, we're going to find that not only can the computers replicate what our specialists can do, they may surprise us with doing some things that we hadn't anticipated were possible from the data that was already available.